As you know, we have already OCTA, but the revolution is it goes faster and larger and deeper. I can say that from cornea to choroid, it involves whole eye, not only vasculature, but the morphological aspect also. So there's a place for whole pathologies, glaucoma, vascular disease, either like a myopia. We can say that it can replace fluorescein angiography, and for some cases, even ICG. Instead of doing angiogram, even without dilation, you do large B scan and you have everything about it. First is to 400 megahertz. It's quite fast. When it's faster, you have less artifacts, so you can go farther with a good resolution. So it's a huge advantage to see the peripheral large field vasculature, especially very important for vascular problems, the peripheral ischemias. With the good segmentation, you can start from the vitreous and can go deeper and deeper to choroid. For diabetic patients of venous occlusion, it has a lot, because with one scan, you can make the diagnosis, you can decide for treatment, and you can see the severity of the pathology, and you can even choose the type of treatment. So I think it's a complete machine. I mean, you can do everything with it.